New reporting out today suggests that Victor Wembanyama is either expected to undergo or recently underwent surgery to address the deep vein thrombosis or blood clot in his shoulder. In this video, we'll talk about what exactly that surgery is and what it means for the young star's future basketball career. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. So we've seen a recent number of videos here talking about these blood clots. Of course, just did a video on Damian Lillard. Same overall pathology, meaning the end result is a blood clot, just in a different location, different causes of the blood clot, but a blood clot nonetheless. We, of course, covered this when it was diagnosed in Victor Wembanyama. We'll recap that briefly here, but it sounds like he expectedly has either undergone surgery or is about to have the surgery. And we'll talk where this involvement in the French national team this summer might come into play here. We're going to rely on our biodigital anatomy tool here for the majority of this video. And I want you to understand up front that a surgery for specifically what Wembanyama had is very standard. That's not unusual in any way. It doesn't suggest some crazy complication. It's a very common thing that's done specifically after this venous, meaning blood vessel, type of thoracic outlet syndrome. So to just summarize, what Victor Wembanyama had was a type of thoracic outlet syndrome. Thoracic outlet syndromes affect the thoracic outlet, the nerves, the blood vessels leaving the neck, going out into the arm. They can involve the nerves or they can involve the blood vessels. In the case of Wembanyama, it involved the vein, developed a blood clot in the vein, something we call Paget-Schrader syndrome, often due to the repetitive overhead activity causing irritation and trauma to that blood vessel and causing this subsequent clot to develop. The surgery that will be done for this type of thing is almost always what we call a thoracic outlet decompression. So the thoracic outlet is that same area that we're talking about. It's going to be that junction from the neck down into the arm. Here, just for reference, we've got the collarbone, the clavicle. We're going to have the pec major muscle here in the front. We're going to hide that. We'll then hide our deltoid muscle. We'll hide some of the scalenes here so that we can focus on just the key muscles that are going to be involved. The muscle that's often involved with thoracic outlet syndrome are specifically going to be the scalenes. The scalenes are these muscles that go from up near the skull down onto the ribs. And in particular, the anterior and the middle scalene often span across a blood vessel, the subclavian artery, as well as where the brachial plexus, this bundle of nerves, exits from the neck down into the arm. So this area right here on the screen, we'll highlight that here with the yellow circle. That's going to be where that anterior and middle scalene can potentially compress the artery. Now, the vein that's involved with what Wembanyama had here, the subclavian vein turning into the axillary vein, often isn't getting as much compressed by these scalenes, depending on your individual anatomy, but you can see how it can run in closer proximity to the first rib. So you're basically, with a thoracic outlet decompression, you're trying to decompress or minimize the pressure on these structures in this thoracic outlet. That can be from the bone, the rib on the underside compressing from the bottom. That can be from the scalene muscles compressing from the top. And then there are some other ligaments and connective tissue structures through this whole area that can cause compression on that tissue. So what they will do in Wembanyama's case with a surgery, if that's in fact what's done or being done and it's a decompression, is they'll go in and they will free up this space by potentially removing muscles, by removing the rib, so that these veins, the blood vessel, the nerves can all have more space to travel from that area in the neck down into the arm. And so that when he's repetitively shooting, you don't get that repetitive irritation and trauma on the blood vessel, potentially leading to another clot. In the short term, they probably did some sort of injection of some medicine to break up the blood clot, or at least oral blood thinner. So something to initially stabilize and help to break up the blood clot before it broke loose and traveled off into the heart or the lungs, causing a pulmonary embolism. But now, since he's going to be continuing to play basketball, you have to change what was there causing that injury to occur. And so in this case, that's almost certainly what they will do. Now, in no way is this like an end to his career. By removing that rib, by removing some of those muscles, you're not really changing anything about the way that his shoulder is going to work. Yes, there will certainly be a rehab and an adjustment period because of some tightness, some postoperative pain, readjusting to some of those biomechanics being altered, but there's no real direct effect on the shoulder himself. So assuming everything goes well with the surgery, we would expect that he would make a full recovery. Most athletes do, and I wouldn't anticipate them causing any issues into next season. Everything with the French national team this summer, right now it's almost April, so April, May, June, 3 months, we're already into June, and I would expect around that time, if not a little bit longer, for Wembanyama to fully recover. Now, he might have had surgery already, which puts him ahead of that schedule. So I think the French national team stuff in the summer, obviously I'm not reporting this, so they might know more than me. That timeline seems maybe a little bit rushed unless he's already had surgery, but not completely out of the picture. But overall, I'd expect him to be ready for the fall. Shouldn't see any foregone like long-term issues with this even after a surgery is done. And hopefully we don't have any other further issues with blood clots. That's it for the video, everybody. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later. Bye.